Hi, do you have some symptoms that are not certain, not clear, don't have certain substrate, your laboratory tests are within normal range, and doctors don't suspect any of the disorder? So this is the subject of discussion with psychiatric doctor. It could be somatic symptom disorder. It is very important to exclude any of the other disease and just after start treating somatic symptom disorder. By definition, it is when a person feels extreme, exaggerated anxiety about physical symptoms. The person has such intense thoughts, feelings, and behavior related to these symptoms that they feel they cannot do some of the activities of daily life. They may believe routine medical problems are life-threatening. This anxiety may not improve despite normal test results and reassurance the healthcare from the healthcare provider. By statistics, 5 to 7% of adult population could be affected by somatic symptom disorder. It's a lot. Women are 10 times more likely to report somatic symptom than men. Why? This is explained by the fact that the disorder is often related to childhood abuse and trauma, to which women are more often exposed than men. So, somatic symptom disorder can appear in any age group. How about causes? Researchers believe that there are many factors, including biological susceptibility, exposure to emotional stress in childhood, and psychological factors such as learned ways of thinking in the context of a person's social environment. And the main factors include childhood, physical and sexual abuse, poor awareness of emotions, development during childhood. This can be the result of such things such as parental neglect or lack of emotional closeness, excessive anxiety and attention to bodily processes, and possible signs of illness. Of course, also low pain threshold, very sensitive to any type of pain. Risk factors. Who is at risk of developing somatic symptom disorder? Studies have found certain risk factors associated with somatic symptom disorder. These risk factors include a history of substance, alcohol abuse, neglect during childhood, physical and sexual abuse, chaotic lifestyle or trauma, chronic illness during childhood. Childhood is very important and have impact on this somatic symptom disorder. Presence of other psychiatric disorders, especially anxiety or depression, heightened attention to bodily sensations. Persons who are very curious about any of the part of the body and any of the changes appearance. Symptoms. What are the symptoms of somatic symptom disorder? So symptoms may be specific sensations such as pain or shortness of breath, or more general symptoms such as fatigue or weakness. Unrelated to any medical cause, they can be identified or related to a medical condition such as cancer or heart disease, but more significant than what is usually expected. A single symptom or multiple, usually patients report experiencing more than one symptom, ranging from mild to severe. So usually more than one symptom, and it can range from mild to severe. And it can change by time, independence of support or medications that taking patient. Ranges from mild to severe, as I said, and approximately 30 to 60% of population of the patient that are affected with somatic symptom disorder, 30 to 60 patients, also have anxiety and depression. How about physical symptoms like pain, neurological, digestive, and sexual? Pain areas of reported pain can include chest, arm, legs, joint, any part of the body. Neurological symptoms such as headache, movement disorder, weakness, dizziness, and fainting. Digestive symptoms such as abdominal pain or bowel problems, diarrhea, incontinence, and constipation. Abdominal pain could be very bad for patient as he or she is addressing to the surgeon and that cannot detect anything, but pain is still present. Sexual symptoms such as pain during sexual activity or painful periods. So, as we discussed, physical symptoms, but pain is the most common symptom, independent on which part of the body is detected. But patients have also excessive thoughts, feeling, or behaviors related to those symptoms, which cause significant problems, make it difficult to function, and sometimes can be disabling. So, thoughts, feelings, and behaviors can include constant worry about potential illness, in times that everything is okay and patients don't have any of the disease. Viewing normal physical sensations as a sign of severe physical illness. Fearing that symptoms are serious even when there is no evidence of any of the problem. Thinking that physical sensations are threatening or harmful. Feeling that medical evaluation and treatment is not adequate and escaped some of the major problem with health. Fearing that physical activity may cause damage to your body. Repeatedly checking your body for abnormalities. Patients are going to different hospitals and do medical checking again and again, examination from different doctors, and reassure he or himself about existing any abnormalities. Frequent healthcare visits that don't relieve your concerns or that make them worse. Being unresponsive to medical treatment or unusually sensitive to medication side effects, especially. Having a more severe impairment than is usually expected from a medical condition. It of course can have some complications. And also for somatic symptom disorder, more important than the specific physical symptoms, patient may experience the ways that interpret and react to the symptoms and how they impact daily life. Daily life activity are impaired practically in any of the psychiatric disorder. Complications could be from impact on daily activity like poor health, problem functioning, including physical disability, problem with relationships, at work, patients become unemployed, other medical health disorders like anxiety, depression, or personality disorder, increased suicide risk related to depression, and financial problems due to excessive healthcare visits, and becoming unemployed, of course. So, treatment for somatic symptom disorder is intended to help control symptoms and help person function as normally as possible. Treatment for somatic symptom disorder typically involves person having regular visits to a trusted healthcare provider. The provider can offer support and reassurance, monitor health and symptoms, and avoid unnecessary tests and treatment. Psychotherapy, or also known as talk therapy, can help the individuals change their thinking and behavior and learn ways to cope with pain or other symptoms, deal with stress, and improve functioning. Antidepressants, the main ones are amitriptyline or SSRIs or St. John's worts, which are very effective pharmacological treatment for somatic symptom disorder. If you are feeling sick, you can address you to a doctor and make the good examination and establish a treatment for this. Thank you very much for your watching. If you like this video, you can subscribe and even like it. Have a great time.